We are facing an epidemic of opioid addiction and overdose deaths in Massachusetts, but with your help, we can stop addiction in its tracks. Mary Lou Sutters is the Secretary of the Office of Health and Human Services, and she joins us to share more about this campaign. Nice to have you here, Mary Lou.
Thank you for having me.
Thanks for taking the time. Now, you're the chairperson of an opioid working group. Now, you toured the state and heard about how this epidemic is devastating good families. Tell me about that experience.
So I'm trained as a social worker, so sharing people's pain is something that I've done my whole professional life. So we were honored to hear from more than 1,100 families, individuals across the Commonwealth, including in Western Massachusetts. Spent an evening at Greenfield Community College listening to the stories of heartbreak, tragedy, and real stories of hope too. So it's, from hope that that you can really overcome what is an illness. This is not, addictions are a disease. This is not moral failures of people. It can affect anyone in the Commonwealth of Massachusetts.
Yes, and it not only affects the person that's suffering from it, but their family members as well.
Yeah.
So to know that there is that support out there, what is causing this crisis, this epidemic?
And it is an epidemic, so thank you for using that word, because we need to call it what it is, we need to label it, we need to contain it, and we need to manage it, and we need to overcome it. So we really focused on prescription drugs. We know that if you start to misuse or use prescription drugs, there's a 40 times greater chance you're going to become addicted to heroin. So that's one message we need to put out there. And we really want people to understand that there's therapeutic effects of these powerful drugs, but there's also a very strong negative. And so we've focused on doctors, on prescribing practices, on helping people, really saying to people, open up your medicine cabinet, see what's in there, clean it out. And one of those statistics that was one of those sort of stand up and take notice was that about 65% of individuals who misuse or use prescription drugs get it from their friends or families. And so we really want to focus on helping parents, give parents the tools that they need to help doctors understand what they need to do different as prescribers, and for all of us to be very aware of this epidemic in the Commonwealth.
We do hear about these prescription drug take-back days. They're so important, and we should really take advantage of the opportunity to dispose of them safely, not just to make sure that they're not disposed of in the wrong way, but also that they're not at risk of getting into the wrong hands.
Absolutely.
So important.
Take-back days, drop boxes. We're hoping to be sort of partnering with a national chain this coming year around pharmacies being able to have take-back days as well. So we're really focused on sort of getting rid of the drugs that are in people's medicine cabinets and giving all of us the tools we need and increasing access to treatment, of course.
So we look forward to hearing more about that and what you'll be doing. Now, how is the state working to treat this disease?
So first of all, we're calling it what it is. This is a disease, and it's a chronic medical disease. It is one where people relapse and then need treatment again. And so, if someone goes into treatment and it doesn't work right the first time, don't give up, go back into treatment, because it is a chronically relapsing illness. So what we're doing in the Commonwealth is really seeing this along the continuum of a public health crisis. So we want public awareness and education, intervention, treatment, and recovery. And we need strategies along all of those avenues, which I think our report did. And actually, more important now, we're implementing the recommendations.
Yes, and letting everyone know what they can do. Now, parents, what should parents know about opioids?
Right. So what parents need to know is that these medications can be very helpful for the management of acute pain, and then can have very significant addictive qualities to them. So if I was a parent and my doctor prescribed my child an opioid, I would ask, is there some other medication available? And if not, to ensure that I only have a couple of days supply, and then get rid of the medication. So we're really looking to sort of have doctors and doctors really explain to families about these medications.
And it's not far-fetched. Your child, your son or daughter has an injury, they may be prescribed that. So these are certain things we need to know as parents about what we can do to be responsible adults.
Absolutely, absolutely.
Now, has there been progress on these recommendations?
So we didn't even wait until the report was finished in June. We really started in February around, because we sort of knew that there were gaps in treatment. So I'm really pleased to say that come September, October, there's going to be 64 new treatment beds opening in Greenfield, Massachusetts, really acute beds plus step-down beds, and we really started that in January, February of this year, because we heard people say that they couldn't find a bed, they couldn't get into a bed. So we didn't just wait till the report came out. So we did that. We expanded family support programs called Learn to Cope. So if anyone is out there as a family member and you want to talk to other families experiencing someone with addictions, or I would absolutely look on their website, Learn to Cope. This is a free support for other families.
It's wonderful, Mary Lou, and we're out of time, but where can people go for more information?
So a couple of places. There's a website, so the state has a website. It's, I'll probably not say it correctly, but it's www.mass.gov/stopaddictions. Has lots of information up on there, and you can also, there's a phone number on that website, and you call that number, it will connect you to someone, a professional to talk to help you access treatment or other information that you may need.
Great information. We need to remove the stigma to help people, and it's wonderful what you're doing to start this. Thanks for your time today, Mary Lou Sutters. Nice to have you here. And for more information, you can call 1-800-327-5050 or visit them online at mass.gov/stopaddiction.